answer. Just watch it. All right. Apologies for the technical issues that we're having. I request the technical team to help us play the video as we figure out the presentation. Kindly play the video if it's ready.
And sexual and reproductive health response services. These challenges can stem from a multitude of factors, including cultural taboos surrounding the discussion of sexual and gender-based violence, discrimination within healthcare systems, language barriers, and much, much more. According to the Canadian National Library of Medicine, factors that limit Black youth's access to health services include a systemic lack of cultural inclusion, a lack of knowledge about information on mental health and other health services, the cost of various health services, geographical, socioeconomic, and locational barriers, stigma and judgmentalism, and limits of resilience. To effectively address these challenges, it is crucial to provide culturally sensitive and inclusive approaches in CSE and service delivery. This entails providing information that is not only linguistically appropriate, but also culturally relevant to its audience. Additionally, training healthcare providers to understand Good afternoon. My name is Simona Williams. I'm a youth advocate, and I'm so honored to be a part of this panel at the Global Conference of Reproductive Rights, Sexual Health, and Gender Equity in the Refugee and Humanitarian Crisis. It is with deep regret that I'm not able to be there in person with you all or my fellow panelists. However, I would love to share some of my opinions on amplifying youth voices and response to SGBV and SRHR services in youth, refugees, and those suffering from the humanitarian crisis. Black youth, including refugee youth, often face a multitude of barriers when it comes to receiving comprehensive sexuality education, sexual and gender-based violence, and sexual and reproductive health response services. These challenges can stem from a multitude of factors, including cultural taboos surrounding the discussion of sexual and gender-based violence, discrimination within healthcare systems, language barriers, and much, much more. According to the Canadian National Library of Medicine, factors that limit Black youth's access to health services include a systemic lack of cultural inclusion, a lack of knowledge about information on mental health and other health services, the cost of various health services, geographical, socioeconomic, and locational barriers, stigma and judgmentalism, and limits of resilience. To effectively address these challenges, it is crucial to provide culturally sensitive and inclusive approaches in CSE and service delivery. This entails providing information that is not only linguistically appropriate, but also culturally relevant to its audience. Additionally, training healthcare providers to understand and respect the needs of certain youth, including refugee youth and Black youth, is truly essential. This training should focus on cultural competence and sensitivity in healthcare and other environments. Creating safe spaces for discussions on SRHR and SGBV is also very vital within communities. These spaces can help to break down cultural barriers and facilitate open, honest, and safe discussions within the community. By addressing these challenges and implementing culturally sensitive approaches, we can improve access to vital SRHR services for Black youth, including refugee youth, and empower them to make informed decisions about their sexual and reproductive health. Regarding sexual and gender-based violence, it's important to understand that SGBV is violence committed against a person because of their sex or their gender. This includes forcing someone to do something against their will using coercion, violence, threats, deception, or cultural expectations or economic means. While girls and women are disproportionately affected by SGBV, it's important to recognize that boys and men can also be victims. Young people, whether they're here in Canada or anywhere else in the world, have diverse sexual and reproductive health needs. This can include access to modern contraception or emergency contraception, menstruation support, HIV and STI testing, gynecological care, pregnancy testing and services, counseling, and support for gender violence and harmful practices. It is with this that I conclude that services must respect a young person's privacy, confidentiality, and maintain informed consent. It is also important that services should be geared to young people to ensure that they receive the appropriate level of care that they need for whatever support that they require. Black young women, particularly those with refugee backgrounds, face unique challenges and require tailored support in order to effectively advocate for themselves and their communities. A study published in the Journal of Adolescent Health found that refugee and immigrant youth are at increased risk of experiencing sexual violence compared to those who are non-refugees. This underscores the importance of providing specialized support and services for refugee youth, particularly young women. Mentorship programs play a crucial role in providing guidance, support, and encouragement to young women as they navigate issues of SRHR and SGBV. By pairing them with experienced mentors, these programs can help young women develop the skills and confidence needed to advocate for their rights and access to services that they need. Leadership training is another essential component of supporting young Black women with refugee backgrounds. Such training equips them with the knowledge and skills necessary to effectively lead for change and advocate for change within their communities and beyond. It also helps them develop communication, critical thinking skills, problem-solving skills, and more, which are truly invaluable to advocacy work. Providing opportunities for young Black women to engage with policymakers and organizations working in SRHR and SGBV directly is truly crucial to the progression of these issues. This involvement allows them to directly influence decision-making processes that impact their lives and the lives of many other refugee youths. By amplifying their voices and ensuring their inclusion in these processes, we can ensure that their perspectives and their experiences are taken into account when these policies are made and changed. Furthermore, creating programs and platforms for networking and collaboration among young Black women can empower them to advocate effectively and progressively for themselves. Some platforms that I recall currently and that I have experienced and gone through myself include the Girls E-Mentorship Program, the Jean Augustine Program, Young Women on the Move, and many, many more. These platforms provide opportunities for them to share experiences, resources, and strategies, enabling them to develop collective approaches to success. By building strong networks, Black young women can amplify their voices and achieve a greater impact in their advocacy efforts. To conclude, supporting young Black women with refugee backgrounds with mentorship training, leadership training, and opportunities for engagement and collaboration is essential to empowering them with the power to effectively advocate for their rights and needs, and also to advocate for the inclusion of refugee youth in decision-making processes regarding SRHR and SGBV. I appreciate all that have taken the time to listen to me at this panel and this conference, and I truly hope that this panel has given you some insights into SRHR and SGBV and how you can help amplify youth voices. Thank you.
Very powerful presentation from Simona. In the interest of time, I will give an opportunity to Andrew Townsend also to make a presentation. Welcome, Andrew.
Thank you. Hi, everyone. Thanks for having me. I really appreciate it. And I'm excited to talk about working with youth, empowering youth. So my name's Andrew Townsend. I am a health promotion officer with Action Canada for Sexual Health and Rights. We are a national sexual health charitable organization committed to advancing and upholding sexual and reproductive rights in Canada and globally. There we go. We are an education and advocacy organization based out of Ottawa, and this is actually our 10th year as an organization. We're an amalgamation of many older organizations who've been doing this work for a long time. But at the national level, we are a voice for sexual and reproductive health and rights, working towards law and policy change. So we do this a number of different ways. We do this through providing direct support through things like our access line. We do this through engaging policymakers, promoting rights through our public health campaigns. And we also do this through collaboration and movement building, both within Canada and internationally. One of the things that I oversee is our National Youth Advisory Board. It's a group of young people from all across Canada who are interested in sexual health and rights. They do a lot of different things. One of the main things that they inform is our Once a Year campaign. If you go to onceayear.ca, you'll see it's a campaign that's directed towards young people, helping to encourage them to incorporate sexually transmitted infection testing into part of their regular health routine. It's run nationally, it's run in markets, different audiences across the country, all directed at young people, helping connect them with services, helping demystify the testing process, and helping answer questions that they have about sexual health testing. So that's the main thing that our NIAB does. They also are involved in giving input on lots of other things that we do, whether that's policies, whether that's things that we do at the UN, or whether that's creating resources that live on our website. One of the things that's really interesting about our Once a Year campaign is that it's a social campaign, and it is meant to speak directly to youth. And because it's speaking directly to youth, we want young people to inform what the campaign looks like. When we first started out, we thought that young people would really respond to like a campaign that was kind of funny or kind of edgy, really made sex seem kind of like just like an engaging kind of meme-heavy campaign. And when we actually talked to young people, they were like, do not do that. That was like one of the worst ideas we could have had. They wanted something that not only took sexual health seriously, but also took them seriously as an audience. And for them, that looked like not just having an engaging campaign, but also having a campaign that addressed different things. So, and I'm glad to talk before about things like thinking about privacy, confidentiality. Those are really big things that youth named. It's a concern that a lot of people have, but it was such a primary concern that young people had, and especially when we did that campaign in, I think we did in 2019 in the GTA for largely newcomer youth, and they named that like privacy, confidentiality were their most important things, and some of the biggest barriers for them actually accessing sexual and reproductive health services. I do spend a lot of time thinking about STI rates and data and things like that. So I just wanted to spend a little bit of time talking about the data, which is really boring when I say it out loud, but I think it's really interesting. We recently did a poll of young people from across the country to get, in general across the country to get their sense of their understandings of their own sexual health information, their own sexual health, and access to sexual health services. And in it, we found that younger Canadians are far more likely to experience even just one barrier to accessing sexual health services. So 63% of respondents who were in the age 18 to 34 category had at least one barrier. And when we compare that to only 43% for people ages 35 to 54, and only 21% people ages 55 and up. So that's 2/3 of young people in Canada have at least one barrier in accessing sexual services, and sometimes even facing one barrier is enough that you just like go home and don't do it. And I kind of like read a lot of reports in my job, and I was really thinking and comparing this to the Our Care National Survey, which came out last year. And in it, it was saying that 63% of people ages 18 to 29 reported having a family doctor, which means that a full 1/3 of young Canadians do not have a family doctor. But that's primarily where people are accessing sexual services. According to our poll, it was like 60, I think it was, I forget what the number is right now. Why didn't I write it down? But majority of people are accessing sexual health care through their family doctor, and if not through their family doctor, then they're accessing it through walk-in clinics, sexual health clinics, or then maybe even not at all. Another report that I really, really love is the Let's Stop AIDS report last year, and it painted a really great picture of where young people are accessing their services, or what they're learning about sexual health and what information that they want to learn. When we're talking about engaging youth, it's really about talking to youth about what they want to know. We find that a lot of young people know generally about STIs, they know generally about pregnancy stuff, But when it comes to questions, things that they want to learn more about, the things that they want to learn about are things like gender, sexual identity, consent, relationships, pleasure, female sexual health, and even the pros and cons of porn. So even people who do get to access sexual health education through schools, they're not getting that information that they actually want. And so maybe they aren't going to classes, maybe they're tuning it out. And then when they leave school, there isn't really a space where people are getting regular, consistent sexual health information and education. And so they just have these questions. And some of the places that people go are, 34% speaking with a family doctor. But again, we know that a full third of young Canadians don't have a family doctor. 47% are talking to friends, 60% are going online, and that's fine. You can learn lots of great things from your friends, you can learn lots of great things from going online, but we want there to be a space where people can access information that, like we're talking about in the video, that is geared towards them, that speaks the way that they want to be spoken to, that answers the questions that they have, and not all information has that. You want information that is inclusive, you want information that is supportive and accurate. The last kind of report that I'm going to talk about right now is from Statistics Canada, and they looked at where do 15 to 17-year-olds access their sexual health information, and overwhelmingly 97% of people responded having at least one source of sexual health information, whether that is healthcare provider, the internet, a teacher, a parent, but one thing that it did identify was that young men, immigrants, residents in some regions around the country, young people who are sexually and or gender diverse, and some racialized populations are among the people that are largely represented among the people that don't have any access to sexual health information. And these are populations that are consistently left behind when we're talking about sexual health initiatives. I was in a call last year with a bunch of people who do AIDS service work, and they were saying that although Canada is largely on track to meet our 90-90-90 goals and our 95-95-95 goals, if people aren't familiar, that means that by 2025, 95% of Canadians living with HIV know their status, 95% of Canadians living with HIV who have been diagnosed have started treatment, and 95% of the people who have been diagnosed, started treatment, are also have achieved viral suppression. So although we are largely on track to achieve those, that's when we really look at a mainstream, largely cisgendered white audience. But if we take out that main core, the people who are being underserved are still being underserved and have been historically underserved, and that includes young people. And that's something I've just been thinking about a lot over the past year, thinking about like how the programs that we run have to really serve and meet the people where they want to be met. Otherwise, we're not going to be able to support them. They're going to continue to be underserved as they have been for many decades now. So when we think about why we include youth, what's the benefit? One of the big things is preventative healthcare. Sexual health information, access to sexual health services, especially for young people, is preventative healthcare. The current federal government is really into the idea of preventative healthcare. I think recently with their pharmacare plan, they were announcing how for every $1 spent on pharmacare for birth control, the taxpayers are saving $90 in downstream healthcare costs or social service program costs. And if that's the way the government understands it, that's great, whatever argument they need to be able to provide these services to people. But there's a lot of other reasons why it's beneficial to connect with young people, to be able to give them information that they're looking for to make choices that they want to be able to make. In our State of Sex Ed report, we identified how high quality sex ed contributes to things like delayed initiation of sexual intercourse, so people are delaying and choosing when they want to have, if they want to have sex. Reduced sexual risk taking, so people are finding ways to practice safer sex in a way that works for them. It shows increased condom use, increased contraception use, increased knowledge about sexuality, safer sex behaviors, and including lower risk of pregnancies, HIV, and other STIs. And in general, it shows improved attitudes related to sexual and reproductive health. So things like positive attitudes towards condoms, getting sexual health care, nurturing healthy relationships, seeking consent, etc. And that's really important, right? Because you want people to be able to be making decisions for them that work for their life. Whenever I'm doing sexual health workshops or talking about decisions that people make related to sexual health, I think that sometimes it's like a big lever that you pull at some point. And once you pull that lever, lots of stuff can start happening that's outside of your control. But the more information you have, it means that you have a better chance to decide when you want to pull that lever. And some people choose not to. Some people choose to pull it when they feel ready. Some people choose to pull it because they think it'll be fun. But you want people to be able to have that choice. And so we also know that from our recent survey that I was discussing, that people who have accessed sexual health services before are more supportive of sexual health efforts more broadly and are aware of how sexual health connects to overall health and well-being, which is really important, right? Because if people are able to access services, they're able to see the benefits of those services, then they're able to advocate for those benefits for other people. And I always think, like, why wouldn't we want to start that with young people? And if it's going to be with young people, then we have to involve young people. We have to talk to young people and with young people to get them engaged in ways that work for them. And so when I'm thinking about working with youth, I'm thinking about two things that really sort of are positive outcomes for them. One is general positive health outcomes. So the things that I was mentioning before, including like lower STI rates, lower unplanned pregnancy rates, and all the sort of other health things that can come along with that. There's also just generally creating a positive youth experience and creating positive health ambassadors amongst youth. So when we're creating campaigns or programs or materials for young people, it means that we're creating a continuum of care. It's creating this space where people who are interested in learning about sexual health can come and be themselves and ask questions and feel heard and feel supported. And then they can share that with other people in their lives, with their friends or family. Youth are generally more open to hearing and learning from each other. So like I mentioned from that Let's Stop AIDS report, 47% of young people are learning about sexual health from each other. And so if we're looking to share sexual information, one of the best ways to do that is by empowering youth ambassadors to speak to each other in ways that they are more likely to hear. And additionally, something that is just as important is that we are creating positive experiences. We are letting them learn about sexual health in safe environments, providing leadership opportunities, and helping connect them to greater supportive communities. And these kinds of experiences are also shown to help provide young people with tools and confidence they need to make tons of different kinds of decisions that work for them. It empowers them to take charge of their health, their relationships, their communities, their future. When you empower, especially anyone, but especially young people, to have agency in their lives, then they're able to see that they can impact their lives in positive ways and impact the lives of their friends and their communities and their family, and that is huge. I often see youth engagement broken down in the following ways. I think it's the next slide, possibly. But it's thinking about them between being youth-friendly, youth-focused, and youth-centered. So youth-friendly is a space where adults create what they think young people are interested in, with little to no actual youth engagement in the creation process. Youth-focused means that we include the input of youth, we get their feedback on stuff, but ultimately the final versions, final drafts are decided by adults. And then youth-centered is where adults and young people work together as partners, creating something, leveraging and seeing the unique abilities and contributions in both groups and creating something that hopefully more strongly represents the needs and interests of young people. And I don't know that the goal is always to be youth-centered. I think that the goal really is that you are honest about the kind of program that you are offering. Like, don't say that you're youth-centered if you're really just getting input and then still deciding on the other end. It's being honest and open with youth, treating them as partners, talking to them about what the limits are of what you're able to provide, what support you're able to offer, and giving them the shape of the opportunities that they're able to come and encounter. The other piece that I keep in mind is which I'm taking. I think the next slide is thinking about good youth work practices, and I'm taking this. I've taken it directly from the folks at Youth Rex. But 6 things that we can keep in mind when we're doing youth work that I think helps work to connect and empower with the young people that are in our communities. The first one is centering youth voices and lived experiences. So, like we said, young people know what their needs are. They know what their lives are like. They know what their barriers are because they experience them. And so, making that the lead, one of the lead inputs is super important. We want to recognize, respect, and value the experiences and contributions of young people. We want to use a strengths-based approach, which means really recognizing what young people are good at, what assets they have and they bring to the discussions, and also appreciating that we want to set them up for success. So I'm not going to ask them to do something that they don't know how to do, have no experience doing, and that they don't want to learn, that doesn't help either of us. So really finding out what they're good at, what they like to do, and help them do more of that. And if they want to learn something, help them learn something. Even though knowing that might take longer or might be a more involved process, if that's the goal, then that's what we have to invest in. We also want to cultivate a sense of belonging. I think that we all know that a lot of programs, whether they're health programs or otherwise, can be really one-sided. They can really be just like show up, do a focus group, have pizza, and go home. But if we're really trying to create a sense of community and a sense of belonging, that'll help young people like feel like they matter, feel like they're involved, and stick around longer to do more great work. We also want to create opportunities for peer connection. So that's connection with, in my case, we have our youth advisory board. So it's connecting, having the youth there connect with each other and feel like they're seeing other people who have the same interests and values and experiences, but also connecting with young people who are outside of maybe the sexual health care space. Sexual health is such a part of our overall health and well-being that there's not a limit to connecting with other young people who might be interested in diabetes health activities or gender-based violence activities. Like there's so many other things that people can connect on. So providing more opportunities for that, because if this is a field that they want to get in on as a career or they want to volunteer in, that's the group of people who they're going to be like aging up through their careers, through organizations with. So why not help create those conversations for them earlier and more strongly? When possible, engaging networks of support, so finding ways to engage not just, like I say, like the youth that's in our program, but also try and help them connect with their friends or family or caregivers, other community leaders that they work with, whether that's teachers, whether that's bosses, but just, again, expanding that, like, this is not the only avenue to be working on sexual health stuff, that they can create their spaces in their own communities to be advocates for sexual health. Again, it depends on the person, depends on the communities, but if that's something that someone wants to do, be prepared to help encourage that. And then also we always want to connect the personal to the political. So adopting critical practices, seeing how we are connecting these individual lived experiences to larger social trends, political moments, political issues. Because again, it can show that's how a person's work matters. I think about when I was a young person, I first got involved in sexual health. I was volunteering at a sexual health clinic. So everything felt very immediate. But now that I work in policy, it doesn't feel as immediate anymore, and you really need to tell that story again and again of how what you do, whether that's like hosting a bake sale to raise money or writing some paper that you're submitting to your student newspaper or whatever. You want to be able to like take that and show how it can inform policymakers, it can connect with decision makers, and how it creates a better overall general community that's focused on supporting sexual and reproductive health. If you're ever looking for sexual health information, I always recommend checking out our resources. If you go to actioncanadashr.org, we have our sexual health information hub, so talking about information that's inclusive, supportive, and accurate. That's a space to go. And people can also contact our access line. It's open 7 days a week from 9 a.m. to 9 p.m. Staff and volunteers are available to answer questions about sexual health, pregnancy options, abortion, and safer sex. We also provide information and make referrals to sexual health care providers, and in some cases can provide financial support for different kinds of services. So these services are out there. Again, if you go to onceayear.ca, you can connect young people to sexual health clinics in their community, and you can also see some of the other work that we're doing. I'm excited for the panel. Thanks for listening.
All right. Thank you so much, Andrew. Thank you so much for our first presenter, Simona, who is not in position to be with us today. I think the two presentations set pace for our discussion, and I'm here to welcome again our esteemed panelists. And of course, I would like to, first of all, reintroduce my panelists again. Next to me here, I have Mary Kinyanjui, right? Mary is an environmental health scientist and LGBTI rights advocate, brings a unique perspective to her work as a refugee in Canada, committed to sustainability and community well-being. Her journey inspires her dedication to promoting sustainable practices and enhancing community health. Mary actively advocates for inclusivity, equal rights, believing in respect and dignity for all. She emphasizes comprehensive sexual and reproductive health for young people, advocating for accessible resources, support systems. Mary's advocacy aims to create a more inclusive, equitable, and sustainable world, exemplifying her commitment to positive societal impact. Her unveiling passion serves as inspiration, fostering understanding, acceptance in communities worldwide. So let's welcome Mary. Then we also have Sherif Analugo, a newcomer in Canada, is dedicated to creating supportive spaces for people living with HIV and newcomers. As a peer mentor, she assists them in navigating services and advocates for women's health and youth empowerment. Sharifa is actively involved in with women's health in women's hands, raising awareness about women's health and issues and promoting access to healthcare services through advocacy and outreach efforts. Additionally, she supports young youths living with HIV through stigma-free zone groups at the People with AIDS Foundation, ensuring they receive holistic care and resources. Once again, let's welcome Sharifa. Of course, the last one, but not... okay. The one and only Ray. Ray is a health and human rights professional and consultant and activist. She currently serves as the founder and executive director for SRHR Hubs, a loud and young-led organization for sexual and reproductive health. Ray holds a Master's of Arts in Human Rights from St. Thomas University and a Master of Arts in Global Health Studies from Queen's University. She has continued her education, training as a sex educator and a full spectrum doula, right? Okay. Certifying in prenatal mental health and is working towards a social service worker designation. Ray brings insights from her lived and living experiences and has worked in both global and Canadian spaces. Her work has been featured at avenues such as the United Nations Commissions on the Status of Women, by entities such as the Sprout Ideas Fellowship. With a decade of experience in youth-driven work, Ray unapologetically advocates against youth tokenism and for realization of conditions necessary to create strong and sustainable grassroots and youth-led spaces. So let's welcome Ray. Of course, with the two presentations that we had earlier on, like I said, they set pace for our discussion. Simona shared quite a number of perspectives with regards to the needs and the challenges that young people, especially ones that are within the refugee sector, face. And also, my colleague Andre also shared some of the incredible work that they do at Action Canada for sexual and reproductive health. So with that, I wanted to, share some questions for them just to help us, dig deep into this discussion. Of course, I'd like to start from Andrew. What are some of the most significant SRHR needs and that are faced by young people, especially those within the refugee settings?
Well, I mentioned that a lot of people don't have access to a family doctor, and that's really huge because that means that when they are coming in contact with the healthcare system, they don't have a regular person to help guide them through things. And that can be really daunting because, depending on someone's status, that can involve having to pay for costs out of pocket. That can involve having to, fill out forms you don't have all the information for. That can involve not knowing if there's a social worker at the hospital that you could talk to that could help you pay for things. Like, it's just this lack of familiarity with the system. So even beyond the difficulty of finding a clinic, getting into places, getting tested, getting supports, it's even once you're there, being able to navigate that system on your own is so hard. And our access line that we run, a lot of the work that we do is, especially working with newcomers and undocumented folks, it's doing that advocacy to hospitals to remind them, hey, you can waive this fee. Hey, you can make this cheaper for people, because cost is such a huge barrier to stop people from even getting in the door of getting healthcare because they know they just can't afford it.
Thank you so much. With that, I also want to pose another question to Ray. She works with the SRHR hubs, and one of their tagline is an organization by the community for the community, which I think is very, very powerful. But of course, I also know that they have unique programs, and one of them is the SRHR maps. And I know they have done quite some good research, especially at the grassroots. Maybe she can also be in position to share some of the challenges, especially the SRHR needs for young people within the refugee settings.
Yeah, thank you, Patrick. First, as an organization that is not refugee-led, we start all our programs, if we are thinking that refugees are somebody who might use our programming, by listening. Listening to what people have to say, what are their needs. A lot of people are rushing out and doing projects, and then they get to the implementation stage. They realize, oh, nobody actually wanted this. We wasted millions of dollars, thousands of dollars, whatever it might be, because somebody thought, oh, we'll build this program, refugees will come. So in particular, the program you mentioned, SRHR MAP, has been a labor of love for our organization. It's been many years of work, of learning, unlearning, making mistakes. And my approach to all of my work is always continuous monitoring, evaluation. What are we doing right? What are we doing wrong? Learning from it, recognizing our mistakes, and continuously improving. So this program, I am the most critical as the person who leads this program, that there's a lot of areas in which we can do better. Knowing that, talking to people, finding out what's working, what's not, and continually improving. So this project has multiple different filters. People can go on our website, see what kind of services they want, filter by things that matter to them. So whether it's access to insurance, or they need free services, or they need a translator, or they want somebody that's from their background. So we're continuously improving the program, adding new things, thinking of new ways, taking stuff down. And really that's the best thing I can say is you're never going to get everything right, and be okay with that, and be okay with continuously improving, and especially for those who are working with communities who they're not a part of, that learning and unlearning is really key.
Wow, thank you so much, Ray, for that insight. Because we're all aware that Canada invites quite a number of young people, especially that are refugees, that come from different walks of life. So I think your submission is very powerful, because you need to keep changing depending on the trends and the dynamics of the needs of young people, because they also change with time. And of course, we also have lived experiences of some of the young people before you here. Maybe we could start with Sharifa to share some of her insights regards to some of these needs, and what could be the challenges that she has faced as an individual in accessing services.
So I'll start with the challenges, because the needs are always there. As long as someone comes from their countries as a refugee to this country, of course, they are not trusting the systems back in their countries to protect them. But even when they come into Canada, they don't know who to trust, because this kind of information is not out there for them to understand and know how to go by the laws, by the policies of Canada, like how is everything done. So that is something that is really challenging, being that you have to navigate to know how the law works here, how everything works here by yourself, and there's no one to train you, not even in the shelters or not even in the hotels that they put us in. So that is one of the challenges. The other one is the equitable healthcare that Andrew talked about, not knowing exactly where to start from, especially when you've not even got that acknowledgement paper that can approve you, okay, now we see you as a refugee. You're just someone, you're still in that process of writing your stories and all that. You do not know where to go in terms of healthcare. Something happens to you, you're like just blank and just stacking yourself on Tylenol or Advil in the shelters and just hanging on until that paper comes. So there is a miss of information around healthcare systems. I mean, as a newcomer, where do I go? Even when I don't have my brown paper yet, even where I've not yet gone into that process. Another thing is around racism. I mean, I've never faced racism until when I came to Canada as a black person. And seeing that people are even dodging to sit next to me in a train, I mean, that was alarming, to say that, okay, I have to take back a step to know that I don't understand who am I approaching in terms of services, because I'm afraid of them taking me in a wrong way, of me facing racism of that kind. So I think we need to create certain programs, and I think this should always come from the airport itself. I mean, we normally come through the airport. They are like our port of entry, or the seas, or people who come on the boats. That is the port of entry. Why is there no information there for me to guide me to understand how Canada works? I've given myself in at the airport. I need to be equipped with the information, not just with Red Cross, because that's the paper they give you of Red Cross, but I need to know organization that I can go to depending on where I'm landing, organization that can be beneficial. And that's why I think I call upon organization to go back to the drawing board, and also make sure that they engage the people that work into the immigration system at the airport or the ports, to be able to come into the discussion